All right, good afternoon, everyone. I see the door is closed. That's the official start. Okay, we're in good shape. All right, good afternoon, everyone, and welcome to the Warren Alpert Medical School of Brown University on this very beautiful day to this beautiful city. It's really a pleasure and a privilege to be able to welcome you to this afternoon as part of the 2023 Family Weekend and to our support network event, guiding students through the medical school experience. For those that may not know me, my name is Mukesh Jain. I've been here a year and a half. I serve as the Senior Vice President for Health Affairs and Dean of Medicine and Biological Sciences at Brown. I want to take a minute before we begin to thank our three panelists. Star Hampton, Senior Associate Dean for Medical Education. Star will tell you a little bit more about herself in a minute. On the other side, Pat Poitevien, Senior Associate Dean for Diversity, Equity, Inclusion, and our newest leader, Sandy Saintonge, Associate Dean for Medical Education Program in Liberal Medical Education. And I really want to thank all three of you for agreeing to serve as panelists today. And I also want to thank our Biomed Advancement team for setting up and overseeing today's panel discussion. Lastly, I want to thank all of you for joining this weekend. Family Weekend is really a special time, a time when students have the opportunity to share their lives on campus with their families for the very first time. Those years have passed me by at this point, but I do remember them fondly. And I, for one, am really excited to share our experiences and this time with you today. So our panel today is to inform you about student experience at Brown University. We also want to give you an opportunity to have any outstanding questions that you might have about the student experience answered. Today's interaction today's engagement is supposed to be very interactive. So please don't be shy. This is your chance to ask questions. And we have brilliant panelists that are answering. And note, I'm not on the panel, right? This is really, so bring on your toughest questions. We have.
I should be recording this.
Yeah, we have leaders. And with that, I hope that today's panel discussion is really helpful and that your visit this weekend will give you a small taste of your students' experience. Enjoy the day, and I look forward to seeing you throughout the weekend. Thank you for being here.
Thank you, Dean Jain. My name is Star Hampton. I'm the Senior Associate Dean for Medical Education here at Alpert Medical School. And I've held this position since August of 2022, so I'm definitely through a full cycle, through a full academic year cycle, and embarking on my second academic year cycle, which has been really exciting. It's so great to see all of the parents here and loved ones. Being a parent myself, open school night is literally my favorite night of the year. Everyone makes fun of me, but I think being engaged in your students' education and understanding how they're spending their lives here with us, either at Brown as a PLME or at Alpert Medical School as a medical student with us, is just really important. And the support you give them is really important. Just briefly about me, I am a New Yorker. I did medical school in New York at Mount Sinai School of Medicine through a program actually quite similar to the PLME program, which I do like to add because I think it gives me a perspective on PLME. I entered Sinai through the Science and Humanities program many years ago, but that program was a program that they had at the time which allowed students to enter their medical school without being a pre-med student. So I did not go the usual pre-med route. I never took the MCAT. I was accepted while I was an undergrad at Williams College to enter Mount Sinai. And so I was a gender studies major, did a lot of art history, economics, English, and then entered Mount Sinai as a medical student. And I think I turned out okay. So I like to say that, you know, what we think about for our PLME students, for those of you that are PLME parents, that exploration of things other than the STEM is really exciting for those students. I'm an OBGYN by training. I did a fellowship in reconstructive pelvic surgery, so I'm a subspecialist of OBGYN, and I joined the Brown faculty and family 17 years ago, so I've been part of this community for a long time, and I really have loved being part of the community here. I think Alpert Medical School in Brown is a really, really special place. I never expected to stay as long as I did. I thought I was moving back to New York City after a few years, but got hooked and love what I do and love the people that I do it with, so here I still am. And I'm absolutely honored to lead the medical school as Senior Associate Dean of MedEd. So I'm happy to entertain your questions today and look forward to hearing from you. Pat or Sandy? Sure, Sandy.
Sure. Thank you very much. First of all, welcome everyone. It's exciting to be here. I am the Associate Dean for the program in Liberal Medical Education, and it's been an honor and a privilege. I started in July, so I'm the newest member of the team. I'm new to Providence as well. I'm a New Yorker. By training, I trained at Cornell for medical school and went on to complete 2 residencies because I'm a glutton for lifelong learning, education, and expanding my breadth of knowledge. So I'm double boarded in pediatrics and preventive medicine. I completed an MPH, a Master's of Public Health at Columbia University. I have over 20 years of experience in undergraduate education, undergraduate medical education, graduate medical education, and I came from the CUNY School of Medicine, which is a 7-year BSMD program. And during my 5.5 years there, I learned quite a bit about what the experience is like for students who are going through a continuum program. I'm thrilled to be here and share my body of experience, which has been transferable to this institution, but what I've been really excited by are the amazing students who have unbelievable talent, their varied interests, and in addition to being able to not only share what I have learned over the last 20 years, I'm learning from them. And I'm really excited to be here and looking forward to answering your questions as well. Dr. Poitevien.
Thank you. Hi, everyone. My name is Pat Poitevien. I'm the Senior Associate Dean for Diversity, Equity, and Inclusion, and you're going to notice a theme here. I'm also a New Yorker. I was born and raised in Brooklyn, New York, but am familiar with Providence and Rhode Island and became familiar with them before my current role because I am a graduate of the PLME program. I graduated undergrad from Brown in 1994, a long time ago, and the medical school in 1998, and actually did my training in pediatrics in New York. And then did additional training to become a pediatric hospitalist. And so clinically, I care for patients, for children who are already hospitalized and continue to do that now at Hasbro Children's Hospital, but spent most of my career in New York at NYU Langone Medical Center and returned to what I really consider to be my home here at Brown in 2018 as the residency program director. And so I've spent several years, almost a decade actually, running residency training programs before moving my focus from graduate medical education to undergraduate medical education. And in this current role that I have now as Senior Associate Dean, I actually get to do a little bit of both because the work of diversity, equity, and inclusion really cannot be siloed and with a focus specifically on undergraduate medical students or graduate medical education. I have an opportunity to really connect my work from the faculty to trainees to students to really impact the entire climate overall that our students interact in. And so my role here is relatively new. I began in April of 2022 in that specific role. So I guess I'm the most senior person on this panel, which is actually quite remarkable. But the work has been extraordinarily fulfilling, and I've had an opportunity to form really wonderful partnerships with the 2 amazing individuals who are here at this table, in addition to many other leaders across the medical school. And we do all of the work in my office specifically to make sure that the environment is inclusive and supportive for all of our learners, regardless of where they come from, how they self-identify, what their ability status is, so they can really thrive while they're here. So also happy to take any questions that you all have.
Great. I think at this point, the afternoon is really for you. So we're happy to entertain any questions. If people have them, please just raise your hand and we'll answer them. While you're thinking of a question, Dean Poitevien and Dean Saintonge, can you talk a little bit about specifically in your areas with the OBEDI, Office of Belonging, Equity, Diversity, and Inclusion, as well as PLME? I mentioned support and the support of parents being so important. What supports do we have for our students through those two routes? And then I'll talk a little bit about the medical school as well.
Okay. Yes. So I can start with that. So for the okay, great, thank you. So for the undergraduates, we have many supports that are available, beginning with the advising deans. These are 6 individuals, some of which are former graduates of the PLME program and have gone through the continuum, so they have substantial experience and diverse backgrounds themselves in terms of their clinical backgrounds. But each student has an assistant dean that they're paired with who is able to advise them throughout the continuum and provide not only mentorship and guidance, but make suggestions on how they can take advantage of the open curriculum, which offers over 100 different concentrations that students can pursue. In addition to the assistant deans who are with the students throughout their time here, we have the Mickle-Johns, which are peer mentors. And these individuals are assigned to students as well, so that at the beginning, once they enter the Brown curriculum and they come to Brown as freshmen, from the very first day, they're partnered with more senior students who can not only provide peer mentorship, but guidance in terms of selection of courses, opportunities they can take advantage of on campus, student groups that they can join, in addition to some of the other initiatives that we have internally within the program itself. Other supports that are available throughout the campus in terms of wellness supports, mental health resources. There are many diversity groups for students who identify based on religion, race, ethnicity, even in terms of where they're from. So students can engage in numerous activities that are individual to their interests. And additional supports, I can go on, there's so much here. I want to go here. I wish I could go back in time and go here. There are numerous other supports that we have available for students in terms of other mentorship opportunities for students to engage in leadership, because that's also part of students' development. We have the PLME Senate. And that organization is really is run by students, the student body that helps govern the students and develop initiatives that are meaningful to students. They also engage in community service as well. So there are numerous different ways that students can engage and be supported, whether it be through the mental health resources that are available, the diverse organizations that can support students based on their individual interests, the assistant deans who can provide mentorship and advising and guidance, the peer mentors who can also develop relationships and support. I can answer more questions about it, but I would like to turn it over to Dr. Poitevien.
So in our office, the Office of Belonging, Equity, Diversity, and Inclusion, we like to offer sort of complementary support services. I think that across the offices of student affairs and the PLME office, many of our students really have multiple options for looking for support. And I think that's important because different types of support, different approaches to what we call support, I think is important because each of the learners themselves is different and might feel more comfortable in a one-on-one relationship with someone who is more senior. They might feel more comfortable in a group relationship with individuals who are their peers, or they may really find comfort and solace in a group of individuals who are similarly identified. So making sure that we're offering really a breadth of supportive services so that students can find what works for them is critically important. In our office, our main programs that help to offer support are one of our mentorship programs, which is called MedStep. That stands for Mentoring and Educating Diverse Students and Trainees to Excel as Physicians. And that's actually a group that is meant to connect students with trainees and faculty who self-identify as being underrepresented. The important part of that really, well, I would say there are two important parts of that. The first is that the self-identification of the individual as being underrepresented is key. So we have a really large umbrella where we want individuals who feel like they are minoritized in the space to be able to step in and say, this is a group that I want to be a part of. And once they self-identify as someone who feels like they're going to get support within MedStep, we obviously accept them. So that I think is really critically important. And making sure that there is connection for the students and the trainees and the faculty is the other part of MedStep that's really important. Sometimes as a student, it can be really difficult to face day-to-day challenges without a vision of what your future is going to be. So being able to connect the students with residents, with fellows, and with faculty members also helps them to sort of see a future for themselves and their careers, but also allows them to ask questions of individuals who have gone through the path that they are looking to embark upon. And so our students really enjoy that. Right now, we've also started a new type of mentorship program called Empowerment Lunches. That's specifically with our first-year students who are underrepresented. And that's just an opportunity to get the first years together and really speak very candidly about some of the challenges that come to first-year medical students, particularly those who are underrepresented, speak candidly about those challenges and really brainstorm around ideas and frameworks and how the students should be thinking about those challenges so that when they come along, they're not surprised by them, they understand that there are resources available, and we can give them a path to really help with any challenges that they have. And then probably the third most important programming that we do is around affinity groups. So we have a ton of affinity groups in the medical school. These are groups that students start, again, based on a shared identity, a shared interest, a shared passion. And the Office of Belonging, Equity, Diversity, and Inclusion supports those affinity groups that are really focused on shared identity. And so we financially support those groups. We help to support them with their activities. We help to manage any fundraising that they want to do. In fact, this evening, 2 of our student affinity groups, one for our Latino medical students and one for our African American medical students, they have come together to do a fundraiser for a local organization that helps to support refugees that come and resettle in Rhode Island. And so they've decided to throw a salsa night. And so we help them in the planning and in the organization of that event. And so whenever our groups want to do programs like that, we help to support them and we help to support their administration as well.
So now we know where everyone is going to go tonight. Salsa.
That's where I'm going. I have my dancing shoes ready.
Perfect. Just to add to what Dean Poitevien and Dean Saintonge said, as you can see already the rich and deep support that we have for our students. But to add to what we have here once they enter 222 Richmond and Alpert Medical School, we also have something called the Mary B. Arnold Mentorship Program, which you may have heard about. That's our longitudinal mentoring program. So students are assigned a physician mentor when they first enter Alpert Medical School and are with that same physician mentor for 4 years. So that mentor really gets to know our student, or your student gets to understand what their needs are, what their trajectory may be as a physician, where there might be obstacles for the student, where they can point them in the right direction. So it's a really nice longitudinal partnership between the student and a physician mentor that's really embedded within our medical school. We also have an embedded therapist in our medical school. So Laurice Gerard is a fantastic therapist, and she's embedded right here in our medical school for students. And she will be getting a partner soon to help her with the needs of our students. So that's a really important resource for our students as well, in addition to other therapy that's available and mental health resources that are available on campus. We also have a learning specialist here that is specific to our students at AMS, so it can be very helpful for students that have learning differences or may just be having challenges with the amount and the type of material that they are being presented with as a student in medical school. It's very different than undergraduate studies. So we do have a learning specialist that is specific to Alpert Medical School, which is terrific. And then we have a fantastic resource named Kelly Holder, who is our Chief Wellness Officer, and she is specific to the Division of Biomed. And she really has a lot of wellness initiatives for our students. Being well as a student and physician is incredibly important, and that's something that hopefully as senior leaders and senior administration we model to our students, but it's really important for them to remember that also, and Kelly really works hard to try and help them stay well and keep wellness, both mental health wellness, physical health wellness, emotional wellness, all of that at the forefront of their minds as they travel through their years with us. We really talked a lot about some other things that I was going to touch on, but peers are really important, and things like affinity groups. We also have peer tutoring, lots of peer help, and the peers here at AMS are really very, very collaborative, and we are in a very non-competitive environment. If they haven't told you yet, our first 2 years are pass-fail, and that's really to help students think about collaboration and to go through medical school in a growth mindset instead of a competitive mindset with each other. So that's just hitting on a little bit of what we have to offer. I'm happy to entertain questions if hands want to go up, or I can keep asking my own. Oh, great. We've got lots of questions. We'll take right here in the second row, blue sweater. If you don't mind actually telling us what year your student is.
Hello, my son is a second-year student. How do you prepare your students for the challenges they're going to experience when they get out of this supportive situation? And I'm not a doctor, so I don't know, but maybe you might be pressured to see, I don't know, 15 patients an hour, or maybe you want to give a patient a certain treatment and their insurance won't allow it. And so how do you prepare the students for situations they're going to deal with when they start working so that it's not such a shock?
That's a great question. Being a physician is difficult in many ways, as all three of us, I think, can attest, and there are lots of challenges to being a physician. I think one of the key things that we hope to really foster in our students early on is that sense of resilience and self-wellness so that they can move into situations like that with a mindset already of self-care and self-wellness so that they have more resilience to match an environment that may not be as kind and welcoming as we are here at 222 Richmond. However, we have our students enter our healthcare systems quite early. They start entering our healthcare systems actually in doctoring in the first year of medical school and even in PLME years. So they are already part of those health systems and learning within our healthcare systems, learning from physicians. Being in situ, I had a student with me this morning in clinic. I saw patients this morning, and they saw, I didn't quite see 15 patients an hour, but they saw the pace that I had, how I handled it. I would talk to that student about ways that I use to manage a full caseload like that. Some of the social determinants that you spoke about, it's all very experiential learning and thinking about how our physicians and our fantastic clinical physician and our clinical faculty model to our students how they handle different situations like the ones you brought up. So their clinical experience is quite rich. It starts very early. It begins in the PLME years, but then here at AMS in the first year. And then we really do see that clinical experience almost exclusively clinical beginning in what we call the third year or clinical years. I don't know if Dean Poitevien or Dean Saintonge have anything to add to that.
I think that was a perfect sum up. I think our students really do get incredible experience in those last 2 years of school because they really are embedded in the healthcare team, and they're responsible for patients. They are responsible for really acting like a resident would. So they would present their patients, present plans on their patients. All of that work is supervised, of course, by the attending and by the residents on the team. But there is a sense that when the students come into our teams that they are not just there as observers or just shadowing us, they're really an integral part of the team, and we make sure that they understand that. And we, I think it's important for them to feel like the responsibility of the patient is theirs, and I think our students really unequivocally, regardless of whether they are on pediatrics or on surgery or on OBGYN, because they spend time in all of the clinical spaces, our students, I think the culture here really is that regardless of what your interests are when you're doing a clinical rotation, those patients that have been assigned to you really are your patients, and there's a great sense of responsibility in how to manage them that our students demonstrate. And so being within those environments, I think, is really the best way to understand all of the challenges that you just spoke about. And there can be even more challenges, delivering difficult news to a patient, how to speak to individuals in other disciplines, how to communicate with nursing staff and physical therapy. So much of what we do as physicians is in communicating with individuals who are not physicians in order to make sure that patients receive the best care. And I think the experiences that our students have during those clinical years really gives them a front seat to what that is, and also engages them in order to do some of that work as well.
Yes, and I'd like to add a little bit to that as well, because as part of the undergraduate portion, students do have an opportunity to engage in the clinical environment from a different lens. Though they're not actual practitioners, they do get a window into it. And a few examples that I can share with you is the first one that students get as freshmen is the whole patient program. And in that initiative, students have an opportunity to hear from a patient and their physician about what that experience is like. So they get to witness and observe and ask questions about not only the clinical experience, but other aspects of that relationship, including the delivery of care, delivering bad news, other topics that may be relevant to that particular scenario that students have an opportunity to observe. In addition to, there's the whole physician, and this initiative was one that was inspired by Whole Patient, where students have an opportunity to hear from residents, medical students, practicing physicians about life after medicine and during the transition from undergraduate to medical school and beyond, and what their day-to-day lives are like, what are the challenges that they're facing, how do they maintain their wellness, in addition to getting married, considering other pathways. So this is an opportunity for students to get a peek into that as well. And then there are other ways that students get an opportunity to hear more, and through the PLME 1000 course, which is our senior seminar. And during that course, we really focus on the transition from undergraduate to medicine, and thinking about how students can understand more broadly the issues that are facing healthcare and the healthcare systems, and what it is like to be a clinician in that changing environment. What I will say, teaching this course for the first time, is that the students are unbelievably knowledgeable about the healthcare system, about social justice, about many of the innovations and changes that are occurring in medicine in real time. And they're really on the cutting edge of all of that and are asking really important questions about how that they might impact medical care in the future.
There was a question, I think someone in the back. Yes, checkered blue check shirt. Just tell us again what type of student you have. College sophomore, great, in the PLME program. Oh, okay. Great.
Thanks. I was a gastroenterologist in town here for many, many years. And one of the things I noticed after I was on the ground in the 80s, that there was a lot of friction between lifespan physicians and ground physicians, and that seeped into the residency programs about who was running what for the medical school, and still seem to be around. And I was wondering if someone is working on smoothing out the different hospital silos versus the med school silos and the affiliation, so that the departments and the divisions could run more smoothly.
Thanks for that question. I think our healthcare systems here in Rhode Island are complex, as you certainly know, and we have a storied history there. I think you'll probably be hearing more about Dean Jain's plans for the healthcare systems and his really incredible collaborative efforts with our healthcare systems and healthcare partners in his State of Biomed address. Dean Jain has been working really very closely with the university as well as leaders of the healthcare systems to address many of the things that you've brought up. Yeah.
I have a freshman who's a PLME, so a freshman just started college. Oh, sorry. A freshman that just started college. So she would be very interested in doing the shadowing that you mentioned earlier, like how you work with a doctor and watch them, how does she get that opportunity? Is there a certain list, or should she call one of you, or anything?
Yeah, so,
particular?
so each, thank you so much, and I think I remember you from that event as well.
I went to the PLME the last time you had.
Yes, the
yeah.
family event, yes.
Yeah.
So that's Medicine in Action.
Oh, medicine.
And yeah, that's
Okay.
what that's called, Medicine in Action, and thank you so much for bringing that up, because that's a clinical shadowing program for which students have an opportunity to get into the clinical environment and observe a physician as they're delivering medical care in real time and ask questions and develop a relationship there. So basically with Medicine in Action, all she would need to do is speak to her assistant dean and
Oh.
just say she wants to get involved.
Okay, that Dr. Julie Roth, is that who you're referring to? Okay, thank you. She would be very interested to do that. Thank you.
Other questions from the,
Hello, my daughter is a freshman PLME student. Where can a PLME student find a research patient case? That's what she prefer in our hometown in the summer, and shadowing experience in our hometown, preferably because this mom wants to see her daughter once a while.
don't worry, my daughters are never leaving me.
Do they know?
They don't quite know that yet, but that is the case.
Right. So we do have summer research opportunities that we offer to students, and there's funding for that as well. And students simply fill out an application for it, identify a mentor, and if their project is accepted, it'll be funded. And that's one mechanism for them to engage in research over the summer. We also have a rich alumni network. So depending on what your daughter, did you say? Your daughter is interested in, we may be able to identify an alumnus who is in that part of the country. Where are you from? Orlando. I'm gonna go with you, with your daughter for the summer. You don't know it yet, but there'll be an extra person that's coming with you, and my daughter will come as well, so there'll be a +2. So really, it would be important for your daughter to speak to her assistant dean that she's advising her, to start to think about a plan based on her interests, of course, the region of the country, and then we could start to work on developing a plan for her to engage in research over the summer, because we absolutely encourage it. It's not required, but we do encourage that students develop those skills.
Other question? Oh, yeah, orange jacket.
So I'm part of this. Okay. Second year med student parent. So our 25-year-old at this point has used up whatever savings he had coming in here and is busy signing, I think, lots of loan documents. So I'm real worried, one, he's going to owe hundreds and hundreds of thousands of dollars, which is going to dictate what he does in medicine. I think it's going to rule out some of the idealism he has, because he just can't afford to do that. So I'm wondering if there is talk as he signs his name to another loan document, what that means, not that he has any other choice, but also do you talk as they get further in the process, the reality that maybe you're not going to be in community medicine now, you're going to have to be a nephrologist or something to deal with the reality of that many hundreds of thousands of dollars.
I looked over at Dean Hampton because, as the pediatricians on the panel, I think we might have a very specific perspective on choice of profession versus debt. And I will be really transparent with everyone here in the audience. The question that you asked is a really critical one. And much like your son, I also had to take out loans while I was here in the PLME program in order to support the cost of my medical education. I think I was, I don't want to say fortunate, but my passion, my drive to do pediatric medicine remained a part of who I was and really dictated what I wanted to pursue, despite the fact that I understood that debt burden. Now, I did go on to work. I've had a really successful career. I'm very glad with my choice. I would not have chosen any other profession in the world. Although I know that many of my colleagues who chose professions that reimburse them at a higher rate probably paid off their loans way before I did. But certainly, I think we try very hard in mentoring our students to be honest with them, because for each person, there's going to be a very different path to what they are the most passionate about. And so usually we talk about our own stories so that students understand that whatever path they choose, whether they make the choice to specialize in something that will provide them more in terms of finances because that's their priority, or they choose to go into a primary care field which might not be as well reimbursed, we help them to understand what their options are in navigating each of those choices, because the choice really is for them to make and for their family to make. So there's no, what I mean to say is there's no right answer. If your son decides that he is really interested in community health, however, he would like to choose a field that's going to reimburse him better so that he can have some support for the repayment of his loans, we would support him in doing that. If, by contrast, he said, you know, I'm really dedicated to primary care, we would look for other programs, like programs that actually provide public service loan forgiveness that would help him to continue to pursue his passion while also making sure to mitigate that debt. I think what we want to do is provide the resources for the students to help them achieve what their vision of their future is and inform them as much as we can with our own personal stories so that they can see what resonates the most with them and what makes the most sense for them.
That makes sense. When does that happen and in what form?
Well, that happens all throughout the 4 years of medical school. So they will be hearing that in different forums. They'll be hearing that from some of their advisors. They might be hearing that from their Mary B. Arnold advisors. In MedStep, for example, we talk very openly about that, and we actually have a session that we provide every year called Financial Wellness, where we have 2 of our faculty members really talk through what all the different options are for loan repayment, for choice of specialty, how the debt that we collect as physicians can sometimes impact our wellness, and what are the best ways to overcome that. So that's a conversation that's ongoing. And it has to be ongoing because the process of growth and professional development that your son is going through and that all of the students are going through is also ongoing. And so we don't want to just have it be one conversation or one session. We know that's a conversation that needs to continue as he develops his idea of the type of physician that he wants to be.
And I will add that, as loved ones and support folks to your students, this may be Pollyanna-ish of me, and I understand that everyone has, finances are extremely personal. Students have all different things that they're supporting, that they need finances for, and financial health is very different for every single one of our students. But I do think that this road is very long, and they've chosen a road that's very specific. And I would really never want a student to choose a specialty that they don't truly love for financial reasons, although I understand that sometimes may happen because of personal reasons. But as support folks, understanding that, pursuing medicine in the profession and in the specialty that the student is passionate about will likely have loan repayment eventually, maybe just with a longer course than something that's a more lucrative specialty. So I do really encourage my students to think about what they're passionate about and what will keep them happy in medicine, because they need to be happy with their specialty and what they choose for the rest of their life.
Sure. I'd like to add on a personal note, I'm a first person in my family to go to college. I have 0 generational wealth. And I went to a very expensive medical school as well, and I went back for more training, which meant that I wasn't earning any substantial income, and those choices were driven by my interests, and I would argue that I have a good life, a happy life, a balanced life. I am by no means rich, but I would, there were many opportunities that I could take advantage of, including working at a federally qualified healthcare center where not only could I serve others, but there was loan repayment, which was able to sort of defray some of those expenses. So I agree. I think that because wellness is so important, choosing a career where there's just satisfaction. The days are long. You're dealing with patients that perhaps have complex histories. outcomes may not be as desirable as you'd like. I think facing that on a day-to-day basis in a field that you're not happy with could be very hard for an individual, though they might be making a substantial more in terms of their income. There is a price for that. So that is definitely an important consideration to take. And it's not to suggest that the decision is one-sided. It's a very complicated decision. You really have to think about a lot of different things. But I do agree that you really do need your child, and all of your children really need to think about what's best for them, in addition to thinking about where they're most satisfied in terms of their career choice. Because you do spend quite a bit of time in long days. So you really want to think about that as well. But there's light at the end of the tunnel. There are many ways, and we do understand that it's expensive.
We have time for maybe one more question. I'm gonna, yeah, because we already had one from you.
Hi, my daughter is in freshman, but she is not a PLME program, so standard program. So I think you may know that this, like 18 years old, they have a all different type of the interest. So, and as you also mentioned, there are kind of like multiple concentrations. So she hasn't decided to the concentration she's gonna go with. But I'm wondering, so what type of the resources you have for those, you know, like maybe the first year and second year undergraduate students, and through what type of the resources she can get a little more, you know, understanding of the pre-med track, or you know, this path.
So
You wanna do that?
I can start with, there's this Center for Career Exploration, which is a great place to start to identify opportunities for professional exploration, opportunities to connect with alum who have experience in the different areas that she might be interested in. There are also the pre-health career advising, if she's interested in going into medicine, that could help her understand what kind of courses that she should be taking. So those are some of the things I could think about just initially that your daughter could use to get some advice and guidance about how to structure a path towards the areas that she's interested in.
Yeah, great resources that Dean Saintonge mentioned. And I'm going to just add, I know that this is, you know, an AMS support and PLME support, and a lot of our PLME students knew they wanted to be physicians at the age of 0. But 18 is still really young to know, you know, what you want to do. And I would say that Brown is an incredible place to explore. And so allowing your child or loved one to explore during her undergraduate years is really valuable to her. And if she does decide to enter medicine at some point, many students do so after they graduate from college or university, and that is actually quite favorably looked on by many medical schools, because the wealth of experience that a student brings after graduation can be very, very valuable to our community. So here at AMS, we have our PLME students who bring a very, very specific richness to our student body, and we love our PLME students, and we love the PLME program. But we also really value our students that come in from other routes who bring that diversity of experience. So even if she doesn't know now, even if she doesn't know in 4 years, she can still enter medicine, and she will probably be a very, very exceptional and competitive candidate.
So with that, I'm wondering if, because she may need a lot of prerequisition, right, to go to the medical school, so that takes longer for her?
So she can, you know, if she graduates from Brown without her pre-med requisites, there are post-baccalaureate programs that are very specific to students that have decided on medicine later. And those are very successful programs, and students usually do quite well coming out of a post-baccalaureate program. I've been told that I need to end so that we all have a chance to hear from Dean Jain for his State of Biomed address. It's been a real pleasure and honor to be with Dean Poitevien and Dean Saintonge today. I am just thrilled that I get to partner with these two phenomenal and intelligent women every day. And it's been really a pleasure to get to interact a little bit with all of you. We'll be here for a few minutes if you have any other specific questions. But thanks so much for supporting your students and for allowing us to be with them for either 4 or 8 or however many years they might be with us. Thanks. Have a great weekend.
Everyone.